precise trauma, increased wound healing, produce collagen and tighten the area, intimate rejuvenation. Now we can treat superficial melasma with microneedling or what we call nanochanneling because we want to suppress the melanocytes that turn keratin sites into that colour that we see on the surface of the skin. So what we're trying to do is actually target the epidermal junction. The epidermal junction on the face is between 0.25 and 0.5 millimeters. So by needling at this depth, it's actually the tip of the needle that is causing the reaction in the skin. So by targeting that epidermal junction, you're suppressing that melanocyte and you're helping break down the keratin sites. We can then infuse the skin with brightening or topical products to help break down that pigmentation further. As an example, the XCellarisPRO Twist range, we have the highlight serum here. These are made up of a high percentage of niacinamide, mandelic acid, salicylic acid, as well as some plant root extracts. We apply this sterile ampule to the skin directly after needling, and what this is doing is it's penetrating deeper into the skin to help break down the hyperpigmentation. Microneedling can also be used on the vulva area, so if we're thinking about intimate rejuvenation, you can use a very shallow depth, 0.5, a maximum of 0.75, and what this is going to do is we're going to infuse the skin with hyaluronic acid in the vulva area, and this is making the area more plump, and therefore we have more sensation to the area. Now it's actually less painful, or we don't say microneedling is painful, it's less uncomfortable to have done on the intimate area. Because of the high vibration, the skin is a lot thicker there, so it can actually tolerate more speed and more deep needle depth. However, we are only using this for rejuvenation, so therefore a shallower needle depth is best recommended for patient comfort and for infusion of hyaluronic acid to the area. There are not any clinical studies today with microneedling and rejuvenation. There are some currently pilot studies that are going on, and in 2026 we should have the results from these, but so far we have observed improved skin texture and improved hydration to the area. If you have a patient that's had breast augmentation, you can do nano needling on the breast tissue for the stretch marks up to a 0.5 millimeter needle depth, and this is going to really produce nice collagen in the area. It's going to tighten the area. If we've had patients that have had the nipple removed and replaced and they have some scarring, we can also do a 0.5 millimeter length on the areola to help reduce the scarring and smooth the area out. Of course, underneath, if we have any scarring underneath, we can do this deeper needling depth so it's not interfering with any other glands in the area. And we were looking at a 2 millimeter to 2.5 needle depth to help smooth and reduce that scarring. And in turn, by performing treatment on the breast area, that's going to have tighter and more firmer skin on the breast and of course the inner chest. So with the XCellarisPRO Twist, when we're holding it, it's forcing us to go in at a 90-degree angle as a practitioner, so you have a heavy weight in here, and this is keeping your hand at 90-degree angle to the skin at all times. It's very important that we're treating at 90 degrees into the skin to create a precise, clean trauma. With other devices on the market that you hold like a pen, you will be going in at 45, maybe 60-degree angle, and this is what's causing micro tearing and micro scratching to the skin. It will also drag along the skin, causing track marks, more surface erythema to the skin, and then in turn this micro scarring can cause damage to the skin at the lower levels. Of course, if we're treating with the XCellarisPRO Twist, we guarantee that we're going in 90 degrees at all times, so we get that very precise trauma. Increased wound healing is much faster, and the downtime is a lot less in comparison to going in at this 45-60 degree angle.